Florence Nightingale arrived from a well-born British family, but chose a radical path in healthcare that would redefine nursing forever. During the Crimean War, she organized sanitation, dramatically reduced mortality, and earned the nickname the Lady with the Lamp. Her statistical approach and emphasis on hygiene transformed hospital practice and laid the groundwork for modern public health and evidence-based care. Her tireless advocacy for reform faced resistance, yet her meticulous reports and persuasive letters inspired reforms across Britain and beyond. Nightingale's legacy endures in nursing education, data-driven care, and compassionate leadership that elevates patient dignity and saves lives.